Hey, everybody. Happy New Year and welcome back to another episode of According to Blake. This one is really personal for me. If you guys have been watching the pod, then you know that I opened up about the fact that I am looking into freezing my eggs. I was supposed to do it this month. I keep putting it off yet again, even though I put it off again last year. But anyway, so I knew that I really wanted to have a fertility specialist on to really dig into the weeds, to kind of calm some of my nerves while hopefully answering questions that you guys have and calming some of you all's nerves. So I am so excited today to be joined by Dr. Morine Cebert. She is a fertility coach as well as the founder of Fertility Goals. And when I tell you guys, I'm so excited. And she told me no question is off limits. So thank you for joining us.
Thank you for having me, Blake.
So I'm going to start with what I had shared on the pod, which was that there were a few things.
Mm-hmm.
Number one, I feel like when you're approaching 30 now, everybody's like, so are you going to freeze your eggs? It's like not even like if you are a woman who desires to have kids, which I do. But with that, there are a lot of factors that I have hesitated on. One of which I talked about that I really want to dig into is I've been on birth control for 15 years. Mm-hmm. I feel like my body is used to it. My skin is used to it. There are so many things. I just don't want to derail my body on some of these things. And another thing was, I love my OB, adore her.
Yeah.
But I think that a lot of these conversations, when they are brought to us, it is, and this is what she told me, hey, if you come back next year for your annual and you still don't have a serious partner, we need to freeze your eggs. So it's almost kind of centered around like, it becomes male-centered, right? Our need to do that. So I really want to talk about how you got into this field.
Yes.
And kind of your background from that perspective.
Awesome. Yeah. So thank you so much for having me. So I am Dr. Morine Cebert. I'm actually a nurse scholar. So I started out as a nurse, went to Boston College, really enjoyed my time there, was just a bedside nurse in the ER. Until one day I woke up with right-sided pain and ended up, after all these scans and tests, found out I had a huge tumor on my right ovary. And so within 24 hours, I was in surgery and my ovary was torse, meaning it twisted on itself. And so they had to go in just to make sure that it had proper blood flow. And so thankfully, they were able to actually untwist it and there was no cell death or anything like that. So I kept my right ovary. And the tumor itself ended up being a benign, non-cancerous, random, like just really large cyst, like the size of a grapefruit. But with that, I ended up having like a C-section, like type incision. So I couldn't be working. ER is like heavy duty work. So I was off of work for almost 7 weeks or so. And while I was laying down one day, I was just like, what am I doing? What's going on? And I just thought, like, what if I lost my ovary? Nobody really told me that that could have been a possibility, but after reading and even the doctor afterwards was like, oh, we were able to keep your ovary. And I was like, I could have lost it.
You never told me that wasn't right.
Like, chill. I literally went under anesthesia and that could have been a possibility. So I wasn't properly informed. And so from there, I just looked up different literature, went to the librarian at my hospital and I was like, hey, what is written about Black women with infertility? And nothing had been in the peer review literature. There was maybe like one New York Times article at the time. And this was 2014. I was 24 years old. And so from there, I was like,
that's when you think anything is possible too. You're I'm just going to get pregnant tomorrow. Like, I'm just going to decide and I'll get pregnant and it'll happen.
At that point, I was trying to avoid pregnancy.
Right.
I was still being like, as a nurse, I was working my 3-day weeks and I was in St. Martin the other 4 days. So I was enjoying life at that point. But for some reason, I just had a wake up call. And I always say it was God too. God just opened up these doors for me. I ended up like breaking up with the guy I was dating at the time. I was like, you're not good for me.
It's incredible the things that happen when you let go of men.
Yes. It's very freeing.
It is
right?
freeing.
There's that like meme or reel on Instagram. It's like women, when they break up, they'll get like a degree from Harvard.
Yes.
Stuff. So yeah. So from there, my really good friend Lisa that I went to high school with, she told me about this program at Winston-Salem State University. And so it was a bridge program to try to increase the number of underrepresented nurse scholars. So I got a master's from Winston-Salem State University while I was training with my mentor from Duke, who actually studies infertility, but she mainly studied white women or white men. And so that was a really great experience. So I got my master's from WSSU, so HBCU grad, yay, and transitioned over to Duke. And so I did my PhD at Duke, and I studied Black women who experience infertility. And I basically looked at 3 different stages of decision making. One, what actually brought you into the fertility clinic or not, or what made you delay treatment? Because Black women were waiting years beyond the white peers.
Yep.
And then what made you actually start the treatment plan in the fertility clinic? So I feel like this is where you are. You've gone through, but like, are you going to start it or not? And then there's some people who started and actually didn't complete it. And so there were so many factors, so many misconceptions. And from there, policy and insurance ended up being a big thing. So I studied women in the state of Maryland. Maryland actually has a state mandate to cover 3 rounds of IVF. So these women were actually having their services covered. So it was a lot of social and stigma factors.
Of course.
That came into play. And then from there, I just wanted to study insurance more. Then I did a postdoc at UPenn through the School of Medicine, and was able to learn so much from my physician colleagues. And they really, brought me in as their peer. And then from there, I was just like, I need something where I'm not just talking to the same academics.
Of course.
I need to talk to the people. I need to educate my girls, my sisters, my family members on what's possible. And so that's how Fertility Goals started.
Well, you are here to educate me today. So I do want to, like you said, I am at the stage where I'm trying to decide like if this is something that I want to do.
Yeah.
And one thing that I found is a lot of women, which is still so interesting to me. I am surrounded by a lot of Black female OBs.
Yeah.
Aunts. My mom went to Spelman. So
awesome.
it's tons of OBs around me. I have a Black female OB that has always told me that birth control is fine.
Yeah.
But there's still women that I speak to that are like, oh no, I'm not getting on birth control because I want to be able to get pregnant.
Yeah.
And so I'd love to start from there, kind of around women. Have you seen any correlation between women who have been on birth control for extended periods of time and their ability to get pregnant?
No, it is not the birth control. It's the fact that they were probably put on birth control to manage a symptom that wasn't investigated properly. And so endometriosis, the first line treatment is birth control. And that is actually a proper treatment because essentially endometriosis is the tissue from your uterus is going outside of your uterus and now going into your bowel and your gut, and sometimes it'll go in people's arms or their heads or their skull. Like it can go everywhere.
Wait, I did know that.
Yeah.
I did know that. I have a friend who said that it had spread so much that she showed me a photo. She had gone in and had a procedure, and she said that it had almost spread to her kidney.
Yeah.
I want to say. Yeah.
And that tissue responds to hormones. And so what birth control does is help with eliminating that response. And as that tissue is responding to hormones, and if you're not on birth control, it can cause scarring in that area. So uterine tissue is not meant to be in other places. So our heart has a specific type of tissue
course.
that is not found in our arms. And, our muscles have different types of tissue based on where they are in their function. And so, the whole purpose of the birth control is to help with eliminating the pain and the scarring of that, which can lead to damage in other ways. What I also find is that people are on birth control and they're not necessarily getting it tailored to themselves. So, for example, I'll even talk about myself. One time I was on the pill and I felt nauseous to the point I was like, Lord, am I pregnant? I know I've been taking it.
You're like, wait.
I've been taking it faithfully at the same time. No, it ended up just being a bit too much estrogen for my body. And so I ended up going on like low estrogen.
That's what I'm
pill.
on.
Yeah. It's just,
every single day.
So perfect.
Since I was 15. I'm like, let's.
And it helps. And then some people are on it because of acne. And a lot of that is hormone related or diet related as well too. So I always tell people that birth control is not necessarily like a medication to treat something, it's to manage it. Mm-hmm. So definitely go backwards and figure out the why. But birth control has really great effects. It is not tied to infertility. More than likely, there's some structural things that just weren't investigated early on. So, yeah.
So for girls like me, though, who have been on birth control for a while. So I have a friend who I spoke to. She had been on it the same amount of time as me. 15 years, was going to do egg retrieval. And they did tell her that she did have to be off of it for a certain time before they can retrieve the eggs, of course. But one thing that me and my best friend were just talking about is that some doctors you'll go and they'll do an egg check, right? To see how many eggs. And then they'll say, we can do it now or you can come back in a few years. You have a little time. So for women who are on birth control, do they have to come off of birth control just for that egg check as well?
Not necessarily. It depends on the
thank
practice.
God.
Yeah.
Okay.
Yeah. So that egg check is called an antral follicle count, AFC. And so they just want to see if like an egg has been developing or not, or even evidence that an egg had ovulated.
Okay.
And depending on the birth control that you're on, like sometimes it suppresses, sometimes it doesn't. So if you're on, for example, like a copper IUD,
Right.
those people are ovulating. It's the copper itself that prevents the sperm from actually like living long enough to go through the fallopian tube.
Got it. Okay.
So honestly, just getting a check, having your hormones checked and all that stuff. And people can the providers can just make a personalized plan.
Okay.
And yeah, they'll often say like, hey, this is what we see now or later. And maybe, depending on the level of dosage, you're on a very, very low dose.
So you mean to tell me there is hope that they'll be like, wow, Blake, your eggs are just abundant. Come back in 2 years.
And then also they're looking at the structures of your uterus.
Right.
They're looking at your ovaries.
Right.
There's all these other factors too that kind of tell a story. And so often I see these like gurus online. They're like, get this one hormone checked or this. No, it's like a whole
Just do
picture.
everything.
Yeah. Get yourself the entire picture. And then from there, your provider can kind of talk to you about these things.
And I want to be clear, as a fertility coach, you coach people through these things. So you direct them to who they need to see or questions they need to be asking. What would you say, and this might be a loaded question, so please let me know if you're like,
fine.
Blake, I cannot answer that in a certain amount of time. What are some of the number one things that you tell women to ask when they go into a fertility clinic or they go to their OB? What are the questions that they should be asking when it comes to the state of their uterus, their fallopian tubes, everything like that?
So first, honestly, I just have people do a personal check before they go into these doctor's offices. And because a doctor's visit is like 15 minutes at best, right? Especially if you're dealing with somebody who takes insurance. 15 minutes, and most of the time is actually going to be with like the medical technician or the nurse. So first is just like, when are you thinking of conceiving? What are your goals for that? How the last few months of your period been, or if it's like your annual exam. I always tell people be mindful of what's going on because you can tell these providers are not patient. It comes from me as well too. I'm a nurse practitioner. And so one of my first jobs out of WSSU, and I worked part-time while I was at Duke, was at an OB office, and they would pack me with like 15 to 20 patients in like a 6-7 hour shift. So I don't really have time to kind of be like teasing in different ways that I did in the ER.
Yeah.
That's why the ER visits are so long because we actually have more time to like get in the nitty gritty, run all the tests and all that stuff while you're there with us. So really writing down what is important to you.
Okay.
And then from there, I think the best thing is just asking, do you see any concerns from what you know about me and my labs about conceiving in X amount of time? And then from there, they can kind of talk about what the offerings are that they have. And then, you can kind of make a plan from there.
And so what do you see? Like, I know that it's important. I have friends that do it. And every woman that I know that has frozen their eggs, they're like, do it. It is the best decision I've ever made, especially after the episode where I spoke about it. So many women. But for some of us, it is this feeling of dread. Like it is this feeling of like, I kind of don't want it. Like, I don't want, like, I kind of don't want it. Like, I don't want to, and I know it's temporary. Like my friend who had a really, really successful retrieval, she gained 10 pounds. Now, yes, it came right off, but you just hear all these things. And as women, I think we're just like tired. Like we're just tired.
Especially Black women.
Like we're exhausted. So in what ways do you encourage Black women? Hell, can you encourage me? Because at this point, I'm just like,
it's just so funny because in my research and talking with different providers, like I am a part of a committee with the American Society of Reproductive Medicine. And so the ASRM they actually set all the guidelines for all the infertility
Mm.
clinics. So I've kind of met a little bit of everybody across the country. That's why I also am able to refer people just so easily. Like, oh yeah, I had lunch with them.
Right.
Like they're
Right.
cool.
It's
And
easy.
this
Right.
is how they think, whatever. But even in the conversations with them, they're saying like, white women, they view this as just starting in the IRA.
Really?
Yeah. Whereas Black women, they just see this almost as like a funeral.
Yes. That's what I had said on the episode. I said, I feel like I'm mourning in my head.
Yeah.
I was going to go to Howard.
Mm-hmm.
I was going to meet a fantastic Black man.
Yeah.
I'd be married by 24. Start having babies by 28. I'm 30. Maybe he'll drop out the sky today. I don't know. And it does. It feels like I am mourning the ideas that I always had about I'll just be able to naturally get pregnant. The ideals that I had around
and you still could
romance. And I still can.
Yeah, yeah.
And I still can't. The ideals around romance, but it does. It feels like deaths.
Yeah. And it's funny. I actually I had this whole postpartum depression thing where I'm like, Lord, what am I doing? And I ended up having a really great session with a life coach. It was a former trainer who was starting his life coach business. So I was like, yeah, I'll help you out.
Right.
Like I'll do a free session, whatever. And one thing that he said that like rocked me, like I like went into tears was we shouldn't like should ourselves to death. Like we're focusing on what life should have been and not necessarily fully accepting how like amazing our lives are right now. And that it's just a little bit different. And we're not the first person in the world to think that, you know, we would have been married at this age and all this other stuff. And not to diminish it, but in some ways there's some beauty in what our story is now. And there's some wisdom now that you can give to somebody who's like literally kicking themselves at 27, 28 and stuff. Who hasn't reached that milestone as well too. And I don't know, I'm not a genie or God, but I do have hope and faith that,
of course,
you know, people's stories will work out in the ways that they desire. Because I feel like those desires came from somewhere.
Absolutely.
I think they came from God.
Absolutely.
And so they will be fulfilled.
So I want to get into egg retrieval before diving more into the fertility aspect. So I want to talk about the women who are thinking about it versus the women who are actively trying. So how long is an average egg retrieval process for a woman not on birth control? Because I know that time frame is different. Or is it different?
No, it's not. Yeah, it's not. So for example, you know, depending on why you're getting egg freezing, right? Is if it's something that, you know, in terms of age and time, you know, you have a little bit of a buffer versus somebody who comes in because they just got diagnosed with cancer. They don't have to wait for anything. They could start today if they wanted to.
Okay.
Yeah. So there's a lot of studies about the stimulation protocols. There isn't really like a major difference in terms of the number of eggs that could be retrieved.
Okay.
So there's not necessarily a long wait. And then, for example, my own story, I was going to actually do egg freezing after my divorce. I was married previously, before my amazing husband now.
See, there are stories.
Amazing.
Okay, so there are. It can happen.
Oh yeah. My 4-year-old son. Yeah. My husband's not his father. It's my ex-husband.
No way.
Yeah,
okay, so how old are you? If you didn't, how old were you? If you don't mind me asking, when you were considering doing egg freezing?
So I would have just turned. I was 32 going on to 33.
And you already had one son. Yeah. Okay.
Yep. I on my like a week after my 30th birthday, I found out I was pregnant.
Wow.
Yeah. And so, that's a whole nother story. I'll get into that. But when my divorce finalized, I was just reflecting, like, I was always the one, like, ask all my friends, my line sisters, everybody, Maureen's going to have at least like 6-7 kids. Like, hands down. I was that
you want
one.
You want a basketball team. Okay.
Yeah, I was straight. I was like, I like minivans. They're cute.
Meanwhile, I'm like, 2.
Yeah. And so for me, I actually felt like a failure at 30, having one child and experiencing a divorce. Like, that happened. My son was less than 6 months old when all that went down. And so anyways, what happened when I was pregnant, I didn't know my husband that long before like we got married and had our baby, whatever. Okay. But we're talking one day and I said something. I was like, oh yeah, like, I found out I have like sickle cell trait. And he goes, oh wow, me too.
Oh.
And I'm pregnant already. And so my first half of the pregnancy just wasn't fun because I had to go an amniocentesis.
Of course.
So it's a needle in my belly. They take out amniotic fluid. And then it takes 4 weeks for the results to come back. Praise God. My son is in the category. He doesn't have a trait.
Oh, thank God.
He doesn't have anything with sickle cell. But I
Okay.
was like, I don't want to go through that again. I know I love Black men, no matter what I said. I knew I was going to end up.
I'm going through that part too. I'm going through that right now too.
Yeah. No matter what I said, I knew it was going to end up with the Black men who ends up having higher rates of sickle cell trait Black men. So I was like, you know what? I want to freeze my eggs because in the future, if I meet somebody who has sickle cell trait, I can do IVF because they can just do pre-genetic testing on the embryos and see which one doesn't have sickle cell, and we can go from there.
Got it.
So with that, so I considered egg freezing at that time as well too. And so when I was talking to my colleagues and stuff, which is me, I could just text them. Right. And they're like, yeah, girl, like, let us know when you're free. So my son was going to be spending the summers with his dad. So I was just going to do it in the summer. So I had time. So I didn't need to like start anything right away versus people that I meet with cancer treatments. The treatment for sickle cell now is bone marrow transplant. Right. So you want to freeze your eggs before that. So those people can start like same day. So it all depends on the provider and how they function. But for the most part, you can go today to somebody, get all your baseline labs if they have the time.
Right. And then from there, it is, correct me if my timeline is off. I assume that's when you begin the hormone injections.
Yes.
And from there, how long does that usually take until you freeze the eggs?
Okay. So it's about 10 to 14 days. It all depends.
It's quick.
Yeah, it's super quick.
That's I can have my eggs frozen by February.
Yeah, you can have, by before Valentine's Day, girl.
So so it's not true that women on birth control need to let the ovaries wake up again.
No. So, I mean, how many times have you had a homegirl forget to take her pill
and then she's pregnant? Those ovaries are still kicking. You're right.
Oral birth control pills are very short acting, like very, very short acting.
I mean, it explains why if you miss 2-3 days, you're spotting again.
Yeah, exactly. So it's not anything that you need to do. You'll find that people who are on like the Skyla Marinas, or like the Nexplanon, the implants.
That was a disaster for me.
Yeah. I didn't like those either.
I had started at a certain weight and then got over the threshold weight. You know, as Black women, the weight fluctuates. Got over the threshold weight, and it was just nonstop bleeding all the time. Yep. And so my OB was like, "We're cracking your arm open right now." She took it right out. So that would make it. Those might take a little longer.
Yeah, because those are slow release. They go into the muscle and the adipose tissue, the fat tissue, and all that stuff. So, typically they require a couple months to just get out of your system. But yeah, everybody's different. Sometimes it doesn't even matter. But even then, you could still start the protocol. It's up to you. Like you could just take out the Nexplanon today and then go from there.
And I want to talk around costs because you have a specialty in insurance and things like that. So many people that I know, so many, in New York, so many of us are creatives. Yeah. We do not have full-time jobs. We have insurance, but it's not full-time jobs that cover, like my insurance covers the basics. It doesn't cover, at least I don't believe it does.
Okay.
So when it comes to cost, let's talk with insurance and then out of pocket cost.
Yeah. So with insurance, it all varies.
Okay.
Everybody has a little bit of a different flavor and it all depends on the state that you're in. So right now, there's about 21 states across the United States that have some level of insurance coverage.
Okay.
They're all like very different. Okay. So if you're in Massachusetts, Connecticut, and Delaware, you have like the best insurance. Like it covers everything.
Okay.
And some are even having legislation to cover like surrogacy as well too. Like it's
I didn't know that.
It's going, it's getting better. But then you have a state like Maryland, like I said, only covers 3 rounds of IVF. So if you need egg freezing or if you need what's called IUI, intrauterine insemination, that's not covered. You have to pay that out of pocket.
Okay.
And then you have to also look into your insurance plan to see if it covers the medication as well too. So what people have done, and I kindly suggest, think about working remote for a company that has a headquarters in Connecticut. Because that company has a mandate. Whatever insurance that they offer needs to follow the state guidelines that they're in.
So I need to find somebody to work for in Connecticut.
Yes.
Okay. I could think around that.
Yep. And then there's some tech companies. That's why when I interviewed my the women for my PhD study, they're all like very high level, multiple graduate degrees, multiple 6-figure jobs. They if they lived in Maryland, but then their headquarters might have been in like Virginia.
Okay.
Because like the DMV
Of
area
course,
is like so close.
absolutely.
What they would do is just get a job at one of the tech companies, Google, I believe Microsoft, I think Starbucks.
Yes,
yeah.
Starbucks was one of the first like fast food, quick food chains to do that. Yep.
So some of them had multiple degrees and they were mixing up people's macchiatos, to get that benefit. I think you just had to work a certain amount of time, like beyond your probationary period, to get it, and they make it work.
So for those paying out of pocket, is there a range maybe you can give?
It's a range, and it's tough. Like a friend called me yesterday. I was like, can you like call around and help me? Like, what are the prices? And one of the big chains that are in New Jersey and New York, it was $14,000 for egg freezing. Okay. Which included a year or two of storage. Yes, which is good. And then she was like, like this. She was going back and forth. Like 14,000 is not,
it's right. It's not throwaway money for most. Right.
But when you think about it, like the cars that we finance, if you break that up monthly, there's so many things. Like these wigs are not.
Can you put egg freezing on care credit? On methods such as care credit and things like that?
I don't know if it's care credit, but there are different insurance and loan financing companies. Okay. Yes. If I could think of one, I think Win is the name. And then like Maven might have some too. Don't quote me on that.
Okay. But there are. Yeah, they do exist.
Exactly. So if you just Google, fertility financing, they might have some either payment plans that you typically do on the front end. And then when you're getting close to like the full balance, then they'll authorize you to, start the treatment with the fertility clinic and stuff. But it's very expensive. Like the technology is expensive. It's not necessarily like a full cash cow that some people think it is, because you have a full team. Like one round of egg freezing includes the nurses, the reproductive endocrinologists, the ultrasound technicians, embryologists, and andrologists. Sometimes
you have everybody.
Yeah, you have everybody. Yeah, you can't just put it in a freezer like Tyler said.
Yeah, it's like that's what I was like. Well, can I put it in mine? Like, can I say put it? So I really, before we dive into the cards, because I feel like this is the perfect feeder. I had mentioned decentering men from the fertility process. Yeah. In what ways can women do that? Because we are going to have to talk about how, in some ways, men are fully centered in the fertility process. Yeah. But for women who desire to have children, what are ways that we can reframe our thinking around having children and our possibilities for having children?
Really good question. And it comes down to a question that my therapist had asked me one time. And she was like, Maureen, do you want any more kids? And I was like, I'd be open, but it all depends on my partner if he wants.
So you don't want 6 or 7 anymore?
They're expensive now. And to like do a family trip, that's a lot of flights, to be purchasing. But it was funny when I said, it depends on if my partner wanted that. She was like, no, why would you put that on him? She was like, what if he's not around? And at first I was almost offended. I was like, are you going to say like he's going to divorce me again? Like what's going on? She was like, no. Like life happens. Yeah. People unfortunately pass away. Yeah. Like I went to Boston College recently. We had 2, really premier athletes pass away. They were riding their bikes, got hit. Both of them, both of their wives had very young kids. One was pregnant. So it really is understanding the capacity of your own self, what you can do on your own. And it's not just about no good men. There's really great men out there, but it's more so what can you, because as women, we're the ones that take the brunt. Our bodies are affected. Our careers are affected no matter what. So a lot of it is just, like I said, really figuring out for yourself. And then also too, men experience male factor infertility a lot. Like
I'm happy you brought that up
of the time. So
and I know we had mentioned this before. Yeah. A video just came out on TikTok. It was a doctor giving a speech. I forgot what, I think it was the ICA, the chiropractic fertility. It was around women and reproduction. And she said that, I think she said 80% of the time, the first 3 months of a woman's pregnancy, so that first trimester, is anything, like we as women, we beat ourselves up, but most of the things are attributed to a man. She said morning sickness most likely is attributed to men. I believe she said preeclampsia attributed to men. So often we as women are told like we're the issue in fertility. When the reality is that men contribute tremendously, not just to our getting pregnant, but our ability to stay pregnant.
Absolutely.
And stay healthy while pregnant.
Yeah.
So in what ways are men contributors to our fertility woes, if you will?
A lot of the times, because when you think of a baby, 50% of the genetics are this other man that you have no idea how they were raised, in what environment, what exposure to toxic chemicals that they had or not. And that can change the morphology or the shape of the actual sperm itself. Understanding their family history is super important as well, too. Understanding how healthy they are in all aspects genetically, right? And so sickle cell is something that was just important to me, but there's so many other things that I could have been testing for, and also my partner, and that, could be testing for as well, too. So, it's very important, and the sperm count has steadily decreased over time throughout the years. It is not as strong. And a lot of that I've been reading into. So I wouldn't say I'm a naturopath, and I wouldn't say I'm a full-on Western medicine. Course. I'm somewhere in the middle.
Of course.
But I am seeing that like these microplastics, the type of, preservatives we have in our food. Course. If we go to Europe, I feel completely different.
I say all the time, here the hangovers, 2 days.
Yeah.
I'm drinking overseas. I'm up the next morning like, let's go again. Everything is different overseas.
Yeah. So there's something to it in the ways that, what we're putting in our bodies are not helping us. And so, I see a lot of the girlies going organic and all this other stuff here in the US. Like, yes, that's great. But when we kind of think about it, like, even those cows and all that stuff are probably treated with things that are not allowed in other countries.
Yeah. So I know that they can see if you have healthy eggs.
Yeah.
So is the same when you go to, if a man were to get a sperm test.
Yeah.
So they can see not just that they're abundant, but that they're healthy.
Yeah. So there's several different markers that they look at for the sperm. The volume of it.
Okay.
The shape of the sperm. It should be like a tail.
The way that it looks on cartoons and everything else. Okay.
Exactly. How it's wiggling. Some of them, like, they're like, broken. They almost look like broken. So that's never going to be able to penetrate an egg properly. If their tail is super short, then that's not going to be able to swim through the fallopian tube as well, too. And then they just look at the concentration of like live sperm as well, too. It is much easier,
of course,
for them to get their sperm tested. And so that's also another low cost thing that I tell people as well to do if they're not able to conceive.
Okay. So I want to dig into, you have these cards.
Yay!
They're called fertility goals. I went through these last night and I just thought that they were so interesting, and it was not what I expected either.
Oh, nice. Good.
So on this one, you rank them.
Yes.
Most important, least important, and important.
Yeah.
And it was so interesting reading these because it brought up so many things that I did not even think about, right? Like, I think I've always thought about if I'd have trouble having kids. I had never thought about if I needed to use somebody else's eggs completely. So I want to go through some of these in terms of like, maybe not important. Maybe we can talk about like how you find it ranks in women that you talk to, where these cards tend to lay and lie.
Yeah.
And we can talk through it. So, well, this one, to avoid pregnancy and parenthood at this time, that's me, very important.
Yeah.
To be a parent, I'm sure that those are high. So to take medication or undergo treatment that will improve my chances of conception if necessary. Do you find that women are hesitant to, especially Black women?
Yeah, that's where the buck stops. It's like, wait, but like there's this medication, and it doesn't have to be IVF. Like IVF is like the last resort. Sometimes people just need their thyroid checked, or sometimes they just need a little bit of a boost in some of the hormones to help with the ovulation, and they're fine. So yeah, sometimes people think it's this huge procedure all the time. When if I can look at your labs, I'm like, oh yeah, girl, like, you just probably need a little clomiphene. Yeah. Which is like a pill you take for 5 days. Yeah, and that's it.
So to be at health status that I believe is healthy before I become a parent, that is really important too.
Yeah.
How important do you find it is there are already things stacked against us, right? It's like Serena Williams, the athlete of the world, almost dies, right? And she has access, almost dies during, while giving birth. So how important do you find that it is for us as women to be healthy at optimal health before conceiving a child?
I find it's very important to people, but they don't know the how. So for example,
what is a healthy body?
Yeah. So, and people just focus on BMI, which is not Serena Williams would technically have a high BMI,
of course,
right? But she could run circles about
right. All of us, and Black women in general, the BMI index for most of us were
not helpful at all. It's more so the food choices. I have people that would say like, "Oh, I want, to eat more healthy." And then they're like, I'm only eating salads and stuff. And then the salads are just iceberg lettuce. Like, no, we need some green, green spinach and stuff.
Nutrient-dense foods.
Yeah, exactly. Nutrient-dense foods. We're not really keeping track of our salt and our sugar intake as well. For preeclampsia and most of the maternal mortality stuff, when I look at the data from the CDC, all cardiac related.
So we need healthy hearts.
And that doesn't start with us just working out today. Ideally, it starts with us actually having schools that did PE and getting into sports and getting very active. Like, being at BC, Boston College, predominantly white institution, them gyms were packed all the time.
Yeah.
When I went to Winston-Salem State, it was just like the girls kind of sitting on the side. The guys might play basketball and stuff like that. But it was a very different, situation, the ways that we're socialized in terms of like exercise.
So would you suggest cardiac testing before? I have a friend, actually, we were friends in high school. We recently caught up at a wedding, and she said that she didn't have any heart problems, so she thought before having a baby, and now she has to get her heart checked like twice a year.
Yeah, because babies add a lot of stress. You have a lot more blood volume because you have a baby's growing blood volume, their amniotic fluid and all that stuff. And they did a study, all the school health centers and a lot of the HBCUs, huge hypertension rates there. And so, it's getting earlier and earlier, and our bodies are not able to sustain a pregnancy. So if you don't want a lot of those outcomes, and yes, in the context of Serena Williams, even I've experienced times where people are not listening to me.
Of course.
No, this is not okay. There are things that we can actually do for ourselves to set us up in a more healthy way.
Well, that feeds into the next one, because this says to be at health status that my healthcare provider says is healthy.
Yeah.
So it is important to consult with our doctors to figure out what they find healthy and to move.
And to trust them.
Yeah.
Sometimes I'll hear stories of like, they told me to do this and I don't like, why don't you trust them? Like,
then maybe you should.
Yeah.
So to know the status of my current fertility potential through blood testing or imaging.
Yeah.
So what does our blood tell us about our capacity for fertility?
So our hormones fluctuate every single day, but usually on the third day of our cycle, which is, so if the first day is the day that you start bleeding, you see the blood in your underwear, you wait 2 more days, then that's the day 3 labs. So that's where you are able to get all of your hormones, and they should be at certain levels. And it's just an easy blood test. Many providers will, order it and all that stuff, and you could just see where your hormone levels are.
And so that ties to this. We see it acted out on television all the time, where a woman while ovulating, so before a period, will be like, get on top of me right now. Or like, around that.
Yes.
What is helpful in that? Like, for those trying to conceive, how effective are those trackers and those apps?
Yeah.
When is peak conception time, if any?
Yeah, so peak conception is typically between days 14 and 16 of your menstrual cycle. So again, the first day is the first day of bleeding, and then you kind of track from there. And that, basically feeling that heat is a sign that you're luteinizing hormone. It's that hormone that really is going to be triggering ovulation is at its peak. Because our body is really made to be procreating. So the symptoms that we are feeling, even from our breast being tender, that's like even the milk ducts like saying, hey, we're ready if you want us and all that.
So there is a science. I know so many women are like, we're going to try next week. It's like, so babes.
No.
You can't just.
You need science.
You can't just get. So this is important too. We've heard, I know Gabrielle Union spoke about this, about how Dwayne Wade told her like at a certain point they just had to stop. So this one says to attempt fertility treatments if necessary until all options have been exhausted.
Yeah.
How often do you see women come in that are like, I will do this tooth and nail until I can't do it anymore, until I'm blue in the face?
When Black women are committed, what's going to stop them?
We see it on everything else.
Yeah, but that also came up in my project where there was a difference between the partners. And so I actually love for this card deck to be done like in early dating and even premarital counseling at some point, just to get people on the same page. Because some people are willing to, take an equity loan out on the house, whereas others are like, no. And that marital tension is often what leads to divorce surrounding infertility.
And I assume the emotional toll too. Like, for Dwayne Wade and Gabrielle, it's clearly not resources.
Yeah. Oh, yeah.
But it's clearly the emotional toll that it continues to take on.
Yeah, it's heartbreaking. What I was reading up on her, and she was saying like she got pregnant several times. So to like that hope and that joy being taken away from you, I'm sure Dwayne was looking at like, I can't see my wife go through this anymore.
Yep.
Yeah.
And so for this one, this is another issue of Black women. To be in full control of the timing when my child is conceived and when I become a parent.
Yeah.
How often do you have to tell women and men, like, you're going to have to let up on this time frame that you've created for yourself?
It's actually 50-50. Because there's some people that are like, I'll just get pregnant, whatever. And like, no, you need to prepare. Like, how's your blood pressure, babes? Like all that. But then there's other people like, no, it needs to be this month. And that is more so like the heartbreaking nature of it. That expectation that isn't met when it's taking a little bit more time than necessary. Yeah, than they feel like is necessary.
And I'm seeing a lot too. All of my friends who are currently freezing their eggs are in committed relationships.
Yeah.
All of them.
Yeah.
So this one says to freeze my eggs or sperm as a method of preserving fertility. Why are you seeing these couples, right? Because again, it was presented to me by my OB like, oh, well, if you had a husband, then we don't need to freeze your eggs. So how are you seeing that in couples now?
Yeah, in couples. So if people are dating, sometimes they're just like, I don't know. Maybe they're still waiting for that person to mature, or that person has said, I don't want to have kids right now. I want to travel the world. Or, training in North Carolina, I met a lot of people in the military. So maybe they have to go on deployment. And so beforehand, they're going to make that decision. And then on the other end, you just never know what the conversations are, like what genetic issues people might have. But I love it. I love when people are in a relationship because it kind of takes the pressure off of things as well too. And so, yeah.
And for egg freezing, oh crap, I just had a brain fart.
No worries.
There was right, okay. The percentage of women who never have to use their eggs when they freeze them, around what?
Oh, they're still kind of collecting that data.
Okay.
It's not something that needs to be reported by like the regulatory boards as well too.
Oh, interesting. Okay.
Yeah. And so it all depends. Yeah. There's some people who just, I don't know. I wouldn't even say like 50%. Like it could be like 60% of people.
But it's a high percentage that never have to.
Yeah. Because they either find somebody shortly thereafter, or they're able to conceive in other ways. Because when you do egg freezing, again, it's leading you to IVF.
Of course.
So maybe you could just do IUI
got it.
ahead of time.
Got it. So, okay, so there are different ways, because just because they didn't use those eggs doesn't mean that they didn't continue deeper into the fertility journey.
Exactly.
So to continue with pregnancy, even if I do not feel ready.
That is big.
I think this is one of the things, like I said, I don't feel ready because I don't have a partner and some other factors. But my mom is always like, she's also itching for grandkids at this point. But she's always like,
they always are.
You get ready. You get ready. You get ready. So as a mother, as both a mother and a fertility specialist, how true is that you get ready kind of see, you're like,
So I tell people, some people think like I went through fertility treatments and like that's what made me get into this work. No, I had a COVID baby.
Oh, okay.
Yeah. It was, I'm like, why am I so tired? And in that moment, like, I had my PhD. I already defended my PhD. I was waiting to move. That's when we all thought COVID would last 60 days.
Yep. We were all, remember when we thought they were like, oh, but on this day, they're going to tell us like we're free.
We'll be back. Right. Yeah. Like, okay. But yeah, I was getting ready to move to Philadelphia and all that stuff. And I wasn't ready. But in that moment for me, it was more of like an ethical issue. And then also too, I had just finished interviewing all these women who cannot conceive. And I felt like the Lord just gave me this amazing gift. And so kind of like got ready.
You're like, I'll figure it out. So it is true. You can't get ready.
Yeah.
And you talked about this a lot, to know my biological family's medical history before attempting to conceive.
Yes.
What are ways by which all of us, men and women, can go and find out what we are carriers for, et cetera, before trying to conceive a child?
Yeah. So a lot of either fertility practices or OB practices have connections with genetic counselors.
Okay.
And so you just honestly have a conversation. And then they kind of ask you, what your history is to prepare ahead of time. If anybody has been to the doctor, that long list of diseases they ask if you experience. Literally see if you can get a copy. They're all found online.
Okay.
I've made like a small little ebook about like how to have these conversations because it's really hard with Black people as well too. Because how many times have we had a family member pass away? We had no idea that they were even sick or anything like that. And so really just going to, you often want 2 degrees of relatives. So your parents and your grandparents, and then like the siblings of
each.
Yeah, of each. So your own siblings, your parents' siblings, and ideally, if you can, your grandparents' siblings as well too.
This was one that I did not even think about at all, to use someone else's donated egg or sperm if needed to conceive a child. I think we think about, at least for myself, it's like, okay, yes, I've thought about if I've had difficulty having children. I've never thought about if I didn't have viable eggs to do such.
Yeah.
And I assume that's a hard conversation to have.
Yeah.
What are those conversations that you're having?
Yeah, it's really big, especially in the Black community, of parenthood. And, men are all about, the academic term is called patrilineity, but like, how many times you Black men
the
like,
legacy. I need my soul.
Yes, my seed, I want my seed. I can't have my seed. All that stuff. And then, the conversation has been big now with like LGBTQ and like Love is Blind and all this other stuff like that going on. But we have a huge shortage in the Black community of like sperm and egg donors and all that stuff. And it's just been such a challenge and frustrating how it's kind of been portrayed in the last couple months.
I don't think I know. I know many lesbian couples, and Black lesbian couples, and I actually cannot say that any of them have Black donors for their children. Yeah,
because part of that is, 1, we don't know our histories, and then 2, there's a lack of understanding. And then, how do I say this? When somebody goes to an egg donor or a sperm donor like business clinic, whatever, you need to have that information from the 2 degrees of relatives. If there are certain things that you have, you actually get disqualified. And so I can name so many people who have like a parent with hypertension and all this stuff.
That eliminates.
Yeah, that eliminates
hypertension. History of hypertension eliminates you from a sperm.
Yeah, and I'm actually kind of
frustrated. We're never going to find Black sperm. What?
But my whole soapbox with that, and I'm going to hopefully do a project on that soon when I have the time, is those are all modifiable diseases. That is not something, it's not necessarily hereditary, but it's because we live in the same context. We're eating the same food. We're probably mimicking the same patterns of the people with hypertension or diabetes. But if we can change that. And then also, I know so many couples, they're like, I'll be fine with somebody's dad or grandmother having hypertension. I'd rather have a child that looks like me.
I don't know anybody super close to me who doesn't have any doesn't have any nowhere.
Yeah.
In 3 generations, I don't.
Yeah. Honestly, it just becomes a liability for a lot of these clinics because, you don't want to give genetic material and then end up having some like cardiac issue and your child is like very sick. But that's typically not the case.
To have a gestational carrier if I cannot carry the pregnancy on my own.
Yeah.
That's something too that I do find that a lot of women are more open to it now.
Yeah.
I think more women are open in saying, like, I'm gonna be honest, I don't want to put my body through that.
Yeah.
Whereas you still have women like me, they're like, but I want the bond. I want to feel the baby kick inside. I want to do all these things. So how is that, especially for Black women?
That's also another thing of like, some people might feel like it's not the full experience. And there are others that are like, no, maybe their goal is to actually have a child that is more genetically related to them. So that's just a means that they're willing to do.
Of course.
And then, of course, there's, the old time myths of like, well, that's that woman's child and all that. No, it's not. And there's plenty of states, part of the one piece that actually makes surrogacy more expensive is the legal piece.
Yes.
And it all varies state to state as well, too. Because there are some states that legally maybe the surrogate might have some, say over her body. And you actually would want that person to have say. They're not, an indentured servant
of course,
at all.
Absolutely.
But then there's other states where, sometimes the parents will have to like legally adopt, but it's like all written out ahead of time.
So is that
legally.
how we run into the issues that we'll see these surrogate horror stories?
Yeah, like I think like Sherry Shepherd or something like that had a really big one. That was tough because that was a lot of personal stuff as well.
Right.
And then, you get people like really in some bad situations. And that's why you need really, really good legal support ahead of time to make sure everything, all the what ifs
are laid out. Now, this one you just talked about, this is why you do not want 6 to 7 kids anymore. Yes. To be financially stable before attempting to become a parent.
Yes.
I know there is no magic number, but I think that there has been a lot of discourse on social media. I don't know if you saw recently on TikTok that family who has all those kids and the kids were sleeping in the living room. It was for days, conversations for days. The amazing the resilient Jenkins.
Okay.
Was in it, and it was for days. And so there were tons of conversations around having children when not being financially stable, right? She's pregnant, right? And these children are in the living room and things like that. And of course, if we dug too much, then it would be a eugenics conversation, which is not at all what we're at. But for you, do you give financial advice of, okay, but there is some sort of threshold that I do think, you all should be at before bringing life into this world?
That is really like a personal thing about like lifestyle and what you want for your children. I don't know that family, but there's another family on Instagram that was catching some heat.
They're everywhere.
Yeah,
They're everywhere.
It was a very conservative Christian family. They don't believe in birth control. And
so they just have a bunch of kids.
11, 12 kids now. But what she did was she posted one day of like, this is how I save money. And she was like, basically no hot meals on like even days. The kids like aren't allowed to change their clothes multiple times a day because that leads to like laundry and all this other stuff. And it was people are like,
if I have to do all that, then I'm not having the kids.
Afford it. Yeah. And for me, it's like private school is very important.
Yep.
The type of trips and experiences.
Absolutely.
I love traveling and I don't want to, have to drop thousands just on the plane ticket, and so just really thinking about the lifestyle and inflation kind of dictates a lot of things too. But yeah.
Well, this is important, especially now, especially with the results of the election, to live in a state or territory where I can get fertility testing and treatment benefits covered by insurance. And I want to dig into that even not covered by insurance, right? Because I think we saw that couple that, was like, I'm anti-abortion and didn't realize that their embryos too had to go.
Yeah.
So I'm sure that you've been getting a lot of questions around if it's even safe to move forward with fertility treatments right now. And that's been something that I've been wondering, do I even want to bring a child into this world in the next 4 years? So how are you navigating those conversations?
Yeah, and it's something that I've thought about too personally. Like, why would I bring
into this
ghetto,
into this
world, and thought about other countries and all this other stuff like that. But I think there's certain states that are always going to be protected. And thankfully, nobody's like proposing any federal bans of anything. Even like the most conservative, candidate was talking about like, he just wants like abortion, for example, to go back to the states. So it all depends on location.
Right.
I remember when the Alabama decision came down, like fertility clinics just stopped. Functioning. They're like, we don't want to go to jail. Let's figure it out. So if you're going to be in like the deep South, consider
other things.
Yeah, but I know there were several practices in Connecticut that were offering like transfers and stuff, like discounted transfers of embryos or even like egg freezing and all that stuff. And again, these processes are like 10 to 14 days long. So if you can relocate for some time to actually get them done, different procedures. So it does become an issue of like privilege for sure.
And I guess we didn't dive into it. We can briefly dive into it before we wrap up. But embryos. We talked about egg freezing, but there is a world where you create embryos, which a lot of couples are doing. So usually in what cases would you advise or just suggest looking into both the man and the woman, doing a proper retrieval and creating some embryos?
If they were actually planning on using them, I would not create embryos just to like have
the way we're freezing eggs.
Yeah, no.
Got it.
I would not. I would always, say both of you have like a military assignment or, it just doesn't work out for both of you to actually implant the embryos, then freeze your genetics separately. We have a 50% divorce rate in this country. And then to literally create an embryo now that becomes a part of your divorce proceedings, or maybe some people change their mind. There's a lot of people that change their mind around kids. I wrote something on like Brides Magazine about that. Like, what if somebody after you get married changes their mind?
Well, we've seen that Sofia Vergara and her husband were fighting over the embryos.
Yeah.
I think there was another celebrity couple that was fighting over embryos. Yeah.
Yeah. It's no matter how in love you are, like I love
is there
love.
not enough legal things around that yet either to protect either party either from, okay.
Not necessarily. And then depending on the state that you're in, like it's just not, it's a messy situation and don't sign up for it. 10 out of 10 would not recommend.
Would not recommend. Okay. So of course this show is called According to Blake, but today it is according to Dr. Morine.
Yay.
So according to Dr. Morine, at what age would you suggest women begin looking into speaking to doctors about fertility, the state of their being, etc.?
Early 20s.
Really?
Absolutely. Yep, because the age that you are now is the age of your eggs. So why not as early as possible? And again, I didn't know left from right in my early 20s. I thought I knew everything. But at least understanding, okay, what is my status right now? Especially for the girlies who've been on the birth control since 14, 15, right? That's almost a decade.
Yeah.
Going into your 20s. And so let's figure out, okay, why were you put on it? Is there room or space to investigate the why? And then from there, figuring out the conversations. Yeah. But that doesn't say that if you do it in your 30s that you're too late or anything like that. But if you have the opportunity to have the youngest and healthiest eggs, why not?
According to Dr. Morine, how much say, input, influence should a man have over a woman's decision to, I know what you're going to say, but I think some people need to hear.
Yeah. That's
how
fair.
much influence should men have in a woman's decision to freeze her eggs or her decision to look into her fertility?
Okay, I was about to say 0. However, when I thought about it, if there's a good man and somebody who's supportive and all that stuff, yes, have the conversation. If it's somebody you feel safe with as well, like have the conversation with them. But at the end of the day, it is your decision, your body. You're the one getting all the injections. You're the one who will be potentially carrying those children as well too. So if it is important to have a child with somebody else, you can consider their opinions, but it should not be the end all be all.
Okay. And you discussed this earlier, but the last one is, so according to Dr. Morine, what are the largest, I guess the most pervasive issues that face Black women trying to conceive?
Ooh, stigma, shame, lack of education on the matter, not even lack of education, like degree-wise. And then faith comes into play. I've seen that kind of deviate. Sometimes people are like, well, if God wants me to have this child, then I'll have it. And then maybe it's God telling me that I don't need to have kids.
Yeah.
Stigma. Like our bodies, I can go on this all day and I know we're trying to wrap up, but we have to really realize the historical context of our bodies. We were enslaved people and our job was to have children. And we weren't performing if we didn't have children. And then, slavery is abolished and now we have too many kids. And then we're seen as a nuisance. It's like, just before this, like I was
a breeder.
I was worth $1 million. You would have sold me in a second and made some money off of me. And then over time, we've just been stigmatized as like these welfare queens and, just people who don't want to work despite the ways that we've been holding down the household, going through mass incarceration, going through the crack epidemic. We held down the households. And so in these moments where we need help and our bodies are maybe not working in the ways that we need to, part of that is stigma from the outside, but a lot of that is stigma from the inside as well too. And we just need to start talking about it and just being more empathetic with people. One thing that I've stopped doing, and I'll apologize to anybody, was just like, don't worry about having kids. It'll happen. A lot of that I was just saying out of my own trauma. And so even when like friends be like, oh, they want to get married or date. And I used to be like, just work on yourself. I'm like, no. Part of that was I just was not in a good relationship and I was enduring a lot. And I felt like that was normal. But we need to have these conversations. And that's why I don't shut down anybody's goals. Whatever your goals are, let's make it happen. Let's make it work.
And I'm really happy you mentioned that. This will be the last question, I promise.
You're
but
fine.
It did tie me to Black women in stress. I have a colleague who was at at one point we worked at the same place, different times with the same place. And she said that during that time, her and her husband kept trying to have that second baby and it wouldn't happen.
Yeah.
It wouldn't happen. And the second she left that job, she was able to keep the baby.
Yeah.
Stress. And I bring that up because you just talked about the expectations on Black women. We went from breeders to nuisances to welfare queens to women who are now down on ourselves because we can't have them at all. So in what regards have you seen stress play on a woman's fertility?
It's huge impact, but it's not something I would ever say. It can be very dismissive if people are like, just stop stressing out and go on a vacation. It's like,
it's not that simple.
It's not that simple. However, like on a cellular level, some of my mentors at Duke and now at NYU, they have studied like the physiological damage to our DNA that stress has caused us. Down from like the telomeres in our DNA are shorter than other groups of people. And a lot of that is generational stress and trauma. Like even like the fears and the anxieties that we have at baseline, if we see the police or dogs and all this other stuff, that's not something that just came about with us here. It's from generations and learned behavior as well too. And so, yeah, that's one thing where I definitely encourage people to just understand what your normal is and maybe it's not that normal. And to really like get some help on that and, really look at the world through a lens of a non-traumatic lens, really. Yeah.
Dr. Cebert, thank you so much.
Thank
Please
you.
Tell them where they can find you.
Yes. So on Instagram, I haven't figured out the TikTok thing yet because I don't know if it's coming or going.
But you need to download it before. So the thing is, and this is for anybody watching, if it is on your phone before the 19th, if it is banned on the 19th, you will still have TikTok. You cannot update it or download it from the App Store. It's being banned from the App Store. It's not a phone ban, if that makes sense.
Oh, got it.
So it will work on our phones. I say all that to say you got to get on TikTok before the 19th.
So definitely on Instagram, you can find me at Fertility Goals. And my website is yourfertilitygoals.com. And yeah, I just be on there. I'm starting to post a lot more. And if you have any questions about anything.
That's what I was going to say. Are you accepting new clients?
Absolutely. Yeah. I'll take HSA and FSA as well too, just because I am a nurse practitioner and I can order labs and all that stuff as well. And so, yeah, I'm here. I'm here to answer questions. And also, I'm not sure when this is coming out, but on February 1st, I do have an in-person event in Bridgeport. And so just talking
this is perfect. This comes out on Monday.
Oh, lovely.
It's coming out,
Yay. So it's a fertility and menstrual health workshop. And it's really just to teach what is the menstrual cycle? What does it mean? What are your hormones? How does this affect fertility? And what are the questions that you should ask? And also ways to really get your point across if you feel like you're being gaslit. Because a lot of people can be gaslit.
Absolutely. Sure. Absolutely. Thank you so much. I feel like there's a million and one more things we could have talked about, but we don't have the time.
Part two,
but thank you so much. Thank you.
Thank you. Yay. Appreciate it.